Hello and welcome to the NHN. Today we are here at Hibiscus Health and Wellness, and we are going to talk to Dr. Jacinta Anyaoku. She is here to answer a few questions and get to know you a little bit better before you ever step foot into the office. Welcome and thank you for joining us today.
Well, thanks for having me.
Just start off with a few questions about you and your practice and what your experience is, so that they can get to know who you are and if you're a fit for them before they even step foot into your office. And so we would love to know what your background, experience, and education is.
Okay.
Tell us about your passion.
Sure. So I am a board certified family medicine physician. I did my training in Ohio, grew up in Ohio, so I went to medical school at Wright State University in Dayton, Ohio. And then from there did a residency in family medicine in Charlotte, North Carolina. And from Charlotte, that's when I decided to move to Houston about a year after graduating from residency. So worked there for a year and then made my way here to Houston. So I've been here in Houston practicing since 2014. And I am board certified in family medicine. I love being a primary care physician, but I also have an interest in dermatology. And actually, when I went into med school, my plan was to become a dermatologist. And it wasn't until my third year of med school, when I was doing my rotations, I fell in love with family medicine and realized that as a family physician, you can do a lot of dermatology in your practice. We get trained in it during our residency. So to me, it was like the best of both worlds. And that's what led me to eventually open this type of practice where I do primary care and I'm also doing aesthetics because it allows me to combine both of my passions.
What made you branch out on your own? I do know that you practiced at a hospital for a while, and so what made you think that you wanted your own practice?
Yeah, so medicine today is very stressful. It's actually not the environment is very hard for physicians, and especially physician moms. So there's a lot of burnout, you are really overworked, and it's just hard for you to be able to give the type of care to your patients that you want to give because you're just so overworked. So for me, it was when I started to have kids. And once I had my first son, I knew that this was just not something sustainable. And by the time I had my second one, I was ready to be done. So I just started exploring different options, different ways to practice medicine. And I learned about direct primary care, and it seemed like a great way to still be able to practice, but practice on your own terms. And so I made the decision to leave, and it's been 2 years and I haven't regretted it.
Now you can have more time with your family as well. That's so important.
Yeah.
So quality of life. Why Katy? Why Katy?
Well, we live here in Katy. So we moved here 2019. I have 2 young boys. My husband works in the oil and gas industry, so Katy was just close by, close enough to the city. Katy's known for having a good school district, so we wanted to be in a place where our boys would have a great education. And I grew up in a very similar town in Ohio, so it was just kind of a natural move when we were ready to move out of the city.
And then what services do you offer? What sets you apart?
Yeah. So I offer primary care. That's one component of the practice, and the primary care follows the direct care model. So this means that we don't bill insurance. So patients pay the practice directly. And the primary form is through a membership model. So patients pay a monthly membership fee, and then that covers all of their services, their primary care services with me in the practice. Then I also have a med spa component to the practice where I practice the aesthetics. And so that side, that is not part of the membership model, so anybody can come and get aesthetic treatments. And so we're just growing and expanding and happy to provide both for the community.
So speaking of growing and expanding, you just brought on Tina, and welcome.
Thank you.
And what is it that you do?
I'm a licensed medical esthetician.
Okay.
I've been doing it for over 8 years. So here at Hibiscus, what I do customized facials, I do hydrofacials, dermaplaning facials, any medical grade facials, and just whatever you need. I'm here to help you and also relax you all at the same time.
So really get that spa experience. Have you guys seen this office? It's beautiful and it's right centralized in the middle of Katy. So it's perfect for any needs that you have. So who is an ideal client for both of you?
Well, I would say for me, an ideal client, since I have two sides of the practice, it's kind of two different types of clients. So primary care side, this is not a traditional model. We don't bill your insurance. So somebody who's going to understand that and know that the reason we don't do that is so that we can provide high quality care. So my patients, when they come, they're generally not waiting. They come in, I see them pretty much right at their appointment time, and they have a lot of time to spend with me. We can spend 30 minutes, we can spend an hour if we need to. But that's because I don't bill insurance. And so I don't have to see a large number of patients every day. So somebody who just really wants to build a good relationship with their primary care doctor, wants to have that feeling that almost like, you're coming to see your doctor, you're coming to see your friend. That's how my patients are. So, and then with the aesthetic side, I would say my typical clients are probably mostly people like me, busy moms who just don't really take the time to take care of themselves. And so my goal is to really just help them to take that time, come in, get something done, learn about what you can do, learn about procedures that are safe, get the education, and hopefully pamper yourself.
Yes, and what I loved when I came in and initially talked to her is that she really has that natural health aspect in mind. I loved that you told me that there were procedures that didn't involve harsh chemicals that could replace fillers, and also on the concierge doctor side, I loved that you would have that one-on-one, that you'll actually listen to concerns and take diet and exercise and supplements into consideration, as well as any medication needs and things like that. So that is why we brought her into the NHN, because she does have that natural health aspect in mind.
Yeah, and actually my residency program for family medicine was one of the first in the country at the time to have an integrative medicine curriculum. So throughout the whole 3 years of my residency, we were just learning about integrative medicine. We did rotations with different types of practitioners. We learned about supplements. So all of that has been part of how I practice from the beginning.
That's wonderful. I love to hear that that's a thing that is out there now. And so what would an initial visit look like for a new client?
Okay, you want to take that one?
Yes, for a new client, we'll have you come in. Of course, you'll do the intake form online, but also when you come in, I'll ask you again any medications or anything like that you're on. I'll have you come in and lay down on our wonderful, comfortable bed and go ahead and start the treatment, but ask you questions as I'm going, and just get you relaxed, and also explain what's going on while I'm doing the treatment, so you can better understand and so you can be more comfortable with me. So that's pretty much how it goes. And after the whole treatment, I want to talk to you and ask you how you felt about it, and just kind of go from there, and be ready to rebook you and have you come back in and see me again.
Make sure you get the results you want.
Yes, absolutely. Yes, so I get in all that information just to, make sure, because I want to customize everything that I do for each patient, because everybody's different.
Right. And I'm sure you have things to take into consideration, people with sensitive skin and
medications that they're on, all of that is very important. So I have all that conversation to make sure that they understand and I understand, what I can use and can't use on that certain person.
Great. And so what does an initial visit look like for you?
So a primary care visit, the first time you come in, we're going to just really sit down and go through your history. So we do have an intake form as well that you're going to fill out beforehand, but I always like to go through and just ask you questions. So typically that first visit is going to be about an hour, and we're really just sitting down and hashing out, what are your concerns? What are some of the things that you've been dealing with that maybe you felt frustrated about and that you want to get addressed? We might not address everything on the first visit, even though we do have the time. It's still hard to address everything, but at least we lay out a plan. Right. So that first visit is really just for us getting to know each other and setting our goals.
Okay. Mm-hmm. And also, you do have family plans as well. For the whole family to get treated. So you also do pediatrics and things like that.
Yeah, I see kids ages 2 and up, and I can take care of the whole family for all of the primary care needs.
This is my favorite part of the interview. I love hearing success stories because it tends to bring out your excitement and things that might identify stories of someone that could come in.
Okay. So a recent success story I had was with one of my weight loss patients. So we do weight loss here, and this patient, when she first came to me, I could tell that because of the weight, it was really just affecting her emotionally, self-esteem, physically, just a lot of symptoms. And so we put her on our program, and she really worked hard and lost a lot of weight, and now she's a whole new person. The confidence is there, much happier, feels better. So that just really made me feel good because I knew that I had actually transformed her life.
Yeah.
And so, and I have others that have similar stories, especially with weight. I think that's one of the things that a lot of people don't like to talk about weight. Weight loss treatments can be very controversial, but the goal is really just to get the patients to feel better and be healthier.
Yeah, it's something that really stood out to me in watching your posts on social media and things was that you really know what is coming up and coming and the how and the why, and you have a gift for explaining it and making it simple. And so I would imagine in your treatment plans that you do the same. And because anyone can go and lose the weight, but having someone to really guide you through it and help you with the how and the why and what lifestyle changes makes a huge difference. Yeah. It's so much more than weight loss. It's that whole transformation kind of thing. I love that. Yeah. And so, and do you want to share a success story?
Yes, I would love to. To kind of a little bit like piggyback off of what she was saying about the self-esteem and everything. I had a client, and she was used to being able to go without her makeup, and she ended up getting on some different medications, which caused her to break out a lot, and she just didn't feel comfortable anymore. She wasn't as confident, and as she was coming to me, I was able to clear up her acne and lighten her dark spots, and every time she came, I could see how much happier she was every time, and her confidence was built. It's an amazing thing to see, and I've got a lot of success stories like that one, but that one in particular, it just made me feel, so ecstatic and just happy because she was so happy. So it's a really good thing to be able to do that for someone.
Go home at night and know that you've made a difference.
Exactly.
So that's wonderful. And so another thing that sets your type of practice apart is that they can also do telemed, right? And so if they're traveling and something happens with anyone on the plan, like if their children or their husbands or family members are on the plan, right?
Yes. So and even without traveling, I mean, we do a lot of telemedicine visits here. So simple things. Not everything requires an office visit. You don't have to come into the office to just discuss lab results. Or if you're having symptoms of a UTI, we talk about it over the phone, I can put orders in, you go to the lab, leave your sample, we get the results, and then we treat you. So very convenient, especially for people who are working and don't always have the time to take off work, but maybe they can take a quick break, go out to their car, the break room, and have a visit. So I love doing virtual visits. Sometimes, my kids are sick and I'm working from home. So my patients know that sometimes I'm taking visits from home. We can do it from anywhere as long as, of course, it's a private location. But yeah, it's one of the conveniences we offer.
And then you also do women visits as well. And so that was something that intrigued me as well, is that you don't necessarily have to have two different doctors, one for your well visit and primary care. And so it's all in one, which I haven't found anywhere else. So
yeah, family medicine physicians are we're actually trained to deliver babies. We deliver a certain number in our residency program, so I can deliver a baby, I can do prenatal care. I choose not to do that in my practice, but I definitely love women's health, and so I do continue the women's health procedures. So pap smears, your well woman exam, I can put in IUDs, remove IUDs, Nexplanons, all your birth control needs. So we can pretty much do everything except for surgical things and anything that's related to obstetrics, pregnancy.
Okay. All right, so the whole package here. Thank you so much for your time. I love your beautiful office and the convenient location, and I really look forward to working with you and NHN and growing our community.
Thanks for coming and talking to us and learning about practice.
No problem.